Hi, my name is Dr. John Heyer. I'm a holistic chiropractor in the Frankfort, Illinois area, which is a southwest suburb of Chicagoland. On today's video, I'd like to share with you something that I specialize in, and that's TMD, Temporomandibular disorder. Common symptoms of this problem include headaches, neck pain, and jaw pain. And you may not know this, but there are over 7 million days of work lost per year due to headaches alone. So you may not have heard of the phrase TMD, but it's very prevalent in its symptoms. Now you may be wondering, how is a holistic chiropractor different than a regular chiropractor? Well, I use chiropractic, acupuncture, nutritional protocols to help alleviate the symptoms and the pain from a problem like TMD. But the number one secret that I have to help people with chronic headaches and chronic pain is using a chiropractic dental approach. And today I'd like to introduce a good friend of mine and colleague, and in my opinion, the best neuromuscular dentist in the Frankfort area, Dr. Harry Kunelis.
How you doing, Dr. Heyer? Thank you.
Good to see you. Say hi to everybody.
Hello, everybody.
Harry, what I'd like to do today is just kind of share with people a case that we've worked together with.
Absolutely. A particular case that comes in mind is a young man at the age of 17 who was in a car accident and suffered needlessly for 2 years with chronic head, neck, and jaw pain. And to make a long story short, the team approach, the chirodental approach in this case, was able to take what various other specialists, various other medical treatments and drug alternatives were unable to do in 2 years. Our chirodental team approach was able to take this case and not only alleviate his signs and symptoms, but completely alleviate and eliminate the root cause of his problem.
Why don't you share with the audience a little bit more about how we did that?
Sure. From a chiropractic standpoint, we can take a look at this diagram here of these inverted triangles, and one can see that the lower triangle here, which represents the hips, the middle triangle here, which represents the mid portion or torso, and the upper triangle here, which represents the head, with the inverted pendulum representing the lower jaw, which is actually movable and not fixed to the upper head. When there's changes that take place in the posture, whether it's through a car accident, an injury, or wear and tear over time through aging, what happens is distortions and deviations take place in the spine. And those deviations and distortions are not only maintained within the spine, but they actually are in the jaw and in the head and neck region as well. So what we're doing with our neuromuscular dental approach is we're allowing changes in the jaw to take place while the chiropractor is making changes to the rest of the body. In other words, if changes are taking place in the rest of the body and the changes in the jaw are not being allowed to take place, then all the conditions that are being corrected are reverting and going right back to their chronic state. So what we're doing very well with a neuromuscular dental approach is we're identifying whether or not the problem is in the jaw and is descending, or if it's an ascending problem, which is something more deeply rooted in the lower half of the body and then working its way upward. So the ascending and descending components in an injury or in a chronic problem are being addressed simultaneously with the chiropractor and the dental, neuromuscular dentist, and the chirodental team approach.
Okay. Well, thanks so much for sharing that today.
Thank you, Dr. Heyer.
Thanks.
Take care, everyone.
So it's pretty easy to see if the spine's lined up and everything is balanced, everything should work well. But when things get out of alignment, whether it's from the bottom up or the top down, there can be a lot of stress and pain focused up here at the neck, the jaw, and the head. Now, there are other symptoms with TMD. Maybe you have teeth grinding, maybe you have sleep apnea or snoring issues. Maybe you have other issues that we haven't even mentioned. But if you or someone you know is suffering from this, I want you to know there is help, there can be relief. And for more information, I'd like you to click over to your right on our website to find out more information on how we might be able to help you. Thanks, have a great day.